Hi, I'm Dr. Clayton Soltesz, an emergency department physician at Washington Hospital. Washington Hospital has been caring for our community for over 125 years. Our emergency department is one of the busiest emergency departments in southwestern Pennsylvania. We provide emergency medical care 24 hours a day, 7 days a week, 365 days a year to at least 48,000 patients each year. No one plans to wind up in the emergency room. Understanding what happens here may help you feel more comfortable about being here during a stressful occasion in the future. When you come to Washington Health System for emergency care, you'll want to leave personal belongings at home. These could be things such as jewelry or medications. When possible, try to bring a photo ID, insurance card, and a list of your medications and any supplements that you might also be taking. You may also want to bring a cell phone charger or a book to read, but they're not required. When you arrive at the ER, you should expect to be greeted immediately and to receive prompt care. Our ER isn't chaotic and frenzied like what you may have seen on television. We work methodically to provide safe, quality care as quickly as possible. Inside of the ER, you can expect to interact with a variety of people. These might be greeters, nurses, technicians, nurse practitioners, physician assistants, and physicians. Each and every one of us is specially trained in emergency medicine. No matter why you seek emergency care, your ER visit goes through 3 stages: triage, treatment, and discharge. Soon after entering the ER, you'll meet a triage nurse. This nurse will ask you why you're seeking emergency help and will check your vital signs, things such as your blood pressure, your temperature, and your heart rate. This process is called triage. The goal of triage is to determine how serious your condition is. A quick, thorough assessment is vital. It determines when you move to the next step of your ER experience. The most critical cases, people whose life or limbs are at risk, will be seen immediately. Others are prioritized on a case-by-case basis. Before transitioning to a patient room, you don't just wait. Depending on your needs, your care may begin immediately. When appropriate, you meet with health experts in a triage room. You may undergo tests such as blood tests, EKGs, urine tests, x-rays, or even CAT scans. Performing these screenings as soon as possible makes the most of your time. When you go to a room, your provider often already has test results available to help guide diagnosis and treatment. You'll be taken to a patient room as soon as possible. We know that it can be sometimes frustrating to wait in the waiting room, but we do appreciate your patience and your understanding. During your time in a patient room, one or more providers will examine you. They review your test results and discuss your symptoms. When appropriate, they will order more tests to get to the bottom of your ailments. Once you have a diagnosis, your care team will develop a treatment plan. This may include lifestyle changes, medications, physical, speech, or occupational therapy, surgery, or even a medical procedure. In some cases, you may need another specialist. Fortunately, you'll have easy access to them. Washington Hospital is home to a wide variety of specialists ranging from allergists to cardiologists to urologists. We're a community hospital with university providers. We work well as a team with our specialty providers, adapting to give each and every patient the best possible treatment. Once the emergency team finishes caring for you, it's time to leave. You may be discharged home. If so, we will provide clear instructions on additional outpatient testing and follow-up care that you may need. When further testing, observation, or treatment is necessary, we will transfer you into an inpatient unit. A member of our care team begins the admission paperwork for you. This makes the process seamless and ensures that nothing falls through the cracks. Our emergency departments at both Washington Hospital and Washington Hospital Green are always open. If you feel that your condition is life-threatening, call 911 right away or proceed immediately to the closest ED. If you have chest pain, severe shortness of breath, stroke-like symptoms, severe abdominal pain, severe headaches, severe infections, or if you have complex medical problems that make your care high risk, emergency care would be appropriate for you. Thank you for choosing Washington Health System for your healthcare needs.